Thank you, Ceann Comhairle. And I want to thank Deputy Brown for sharing his time with me this afternoon. Minister, I'm going to focus basically on children's mental health and intellectual disability teams, and it's a huge issue that I have in Galway. Well, we have the figures there before me, and it would seem that the CHO2 is absolutely really brilliant. It's a distorted figure, to be quite honest with you, and it comes from in relation to the intellectual services and the disability services within it. Because going back to the day, and I'm only talking last April, there was a meeting held in Merlin Park, and it had actually to do with a lot of the children who were actually primarily diagnosed with autism, but were actually down under the section to do with CAMHS. And at that time, they were promised that all the 200 parents that were there, along with the GAP, Galway Autism Partnership Group, that every parent in that room would be receiving a letter, because they were transitioning them away from CAMHS, just like what you said in your introduction there, and they were putting them on the right pathway for the intervention. Now, that does not mean to say that all of the children might not have needed some formal level or intervention with CAMHS, but there was a pathway being put in place. Regrettably, to date, Minister, the assessments are only starting, and have only started in the last couple of weeks, okay? And not all of those parents have received a letter to date, which is very, very unfortunate, because that day in that room, I listened to people who were in excess of 2 years waiting for a letter. These were parents who had children in 4th, 5th or 6th class and were concerned about them going into first year and what provisions would be put in place for them in the secondary school. But can you understand, nearly 12 months on, that letter hasn't been released, which is very unfortunate when I stand here and I see I have nothing on a 6-month waiting list, or I have nothing there for 9 months, or I have nothing for 12 months. And I know myself that is not fact. That's not what was on the ground. Before I came in here today to speak on it, I rang Galway Autism Partnership Group, and they were actually telling me there that the assessments now, while they're just starting, it has been outsourced. Okay, the parents aren't confident at the moment because they're not getting the letters. So I do, and what was also said to me, really, Anne, what really is, it's unfortunate that a child with an intellectual disability is at a disadvantage as opposed to a child that has a physical disability, and that's not right really at all, Minister. And as you know yourself, intervention and early intervention is key in all of this matter. And unfortunately, that's not what we're getting. We have people waiting far too long for that intervention. And the intervention should not have to come at the critical place within the CAMHS if we have got the intervention earlier within the primary sector, just like what you have to say in the primary care units. But I do think we need to actually give more support to the primary care units. They need more of a wraparound service. While you talk more about e-care and everything else like that, I think we need to do far more in a consultative practice there to bring them on board, because I don't think that a lot of the primary care units are at that level of intervention. Like, at the Oireachtas Mental Health Committee, you spoke about where there would be the room and where a person could go in and they could go basically virtual to wherever that consultant would be, and they would get that intervention. I actually think that is a fantastic way of giving the relief to the family and to the child at that moment in time. But I need to see it being rolled out. I don't see it coming west at this moment in time, and if it is, please tell me what level it's at, because I would positively promote it. And I also think schools need to know that if that's the way it is, it would be fantastic, but it's not there. At this moment in time, the only way parents and a lot of the community involved think the only way you can get an assessment or any level of support is by going through CAMHS. And that's the only level. We know that the staff aren't there. We know there's a huge problem at all levels in providing the support when it gets in there. Also, in relation to beds for children. It's a huge issue in Galway yet again, where we have young children who end up on adult wards. That is totally and utterly unacceptable. And when Dr. Niall Muldoon came before the Oireachtas committee, he spoke passionately about his feedback in relation to children and their experiences and what they had to witness at quite a young age to be placed in an adult psychiatric ward. It is actually shocking to think that we would do that to children. While they would have issues going into it, they were certainly coming out with a hell of a lot more issues after the experience of an adult ward, Minister. I think we need to see how we can actually ring fence, while it might be brilliant in the new children's hospital, but we need to ring fence more beds around the country. I have CAMHS in bed stay in Galway, but it covers only 11 counties. I think we need to look at where we can ring fence beds. Thank you, Ceann Comhairle.